Okay, good morning and welcome again to HIV 2020 Online. We're going to instruct everyone here to please choose the audio channel. You'll see that on the top of your Zoom window under interpretation. Please choose the audio channel for the language of your choice by selecting interpretation and then the language. Mute original audio to only hear the interpreter. HIV 2020 Online operates on a zero-tolerance policy for any kind of bullying, harassment, abusive language, aggressive expression of opinion, or any such undesirable behaviors. Session participants who engage in such actions will be immediately removed from the session with no prior notice. This is a grassroots response to the drug war, fighting back. In Vancouver, Canada, and Columbus, Ohio, harm reduction has emerged as a community-led response to North America's overdose crisis. That's the story that we're going to tell today. One last reminder, this event is being recorded and broadcast live on Facebook and will be, upon completion, uploaded to YouTube and available there. And so, while we want to create a safe and confidential environment, please know that this is being recorded and will be widely available. Okay, the voice you've been listening to is Travis Lupik. I'm a journalist who's been covering the opioid epidemic, addiction, and harm reduction full-time for, wow, more than 6 years now. I'm also the author of a book called Fighting for Space, How a Group of Drug Users Transformed One City Struggle with Addiction, that you can find online on Amazon and local bookstores in Canada and some across the United States. I'm going to take you through a story that takes place in Vancouver's downtown east side. That's the street you see on the cover of my book there. That's East Hastings Street, where it bisects with Carroll Street. The downtown east side is, to put it bluntly, a stereotypical ghetto. There's a lot of poverty. There's a lot of addiction and open drug use. There's a lot of mental illness. And Vancouver, a city where the wider metro area has a population of about 2 million, has sort of crushed all these problems into just a few square blocks around Main and East Hastings, the streets you see on your screen now. It's also a community with a lot of heart. The downtown east side is the sort of place where one story that always comes to mind is I saw a woman across the street from me crying as she walked, and another woman who I overheard she didn't know, come up and give her a hug. It's a rough neighborhood, but it's the kind of neighborhood where you can receive a hug from a stranger when you need one. Like I said, packed into a few square blocks. This is a map that appears in my book, Fighting for Space.
Travis, I'm so sorry to interrupt you, but you're not sharing your screen. We don't see the presentation. Apologies.
I'm so sorry. Has this fixed our problem?
Yes, it has. Thank you.
Okay. Very quickly, here is East Hastings Street. Glad we got this sorted out. Thank you, Rachel. And here is a warm community along East Hastings Street. And here is the downtown east side, packed into a few square blocks. Those dots represent things like injection sites, things like headquarters for the Vancouver area network of drug users, which we'll hear more about, things like needle exchange. This is a small area. Whenever journalists visit Vancouver and ask me for advice, one of the questions I get is, where can I rent a car? And I say, you don't need to. You can walk around the downtown east side in just a couple of hours. Vancouver has packed a lot into this one little neighborhood. This is a screenshot that I took off of Google Maps. I easily could have taken this picture myself, but I did it off Google Maps to sort of emphasize how typical this scene is. Open street markets, that sort of thing. Like I said, we've crushed a dense scene of poverty into one little neighborhood. There's also a measure of safety that comes with this that I've found. When the streets are crowded at 3 in the morning, there is less of an opportunity for dangerous, violent things to happen. I see that someone's raised their hand. We're going to have a Q&A session at the end of this presentation. And so if we could hold questions till then, there's also a Q&A box that we're encouraging people to use. But there will be time for an open-ended discussion in about 40 minutes from now. Another shot of East Hastings Street. Again, that street market that I mentioned. Vancouver has taken, in recent years, a largely hands-off approach to open drug use, and so up to personal possession, that sort of thing. And so it's not uncommon to see open drug use on the streets. And in 1991, jumping back, 30 years now, it's into this neighborhood that a young nurse named Liz Evans wandered. Liz had just completed a nursing degree in Eastern Canada, had taken a job at Vancouver General Hospital, sort of the premier hospital in Vancouver, working in the emergency mental health ward there. And she hated it. She didn't like the way that her patients were treated. She didn't like the way that she found herself forced to treat patients, where people were just kind of cycled out of the system, where if a problem couldn't be fixed, that person was ejected rather than accommodated. Liz would come home from work every day crying. And so after completing her nursing degree and moving clear across the country and taking this great job at the premier hospital in the city, Liz quit. And into the downtown east side she wandered to this place called the Portland Hotel, actually called the Rainbow Hotel back in 1991. The Rainbow Hotel had a job opening. Liz applied for the job opening, went in for a job interview, was told that she was being interviewed to run mental health services in the hotel. Liz left the job opening, returned home, her phone rang, and Liz got the job. Nobody else had applied. The Rainbow Hotel was in that rough neighborhood that we saw earlier, the corner of East Hastings and Carroll Streets, and it was empty. It was your stereotypical SRO, it's the term that they use in cities like New York and Vancouver. Single room occupancy is what it stands for. It basically means there's a bunch of tiny rooms on each floor and then a shared bathroom. These hotels are often very run down, often again a lot of open drug use, some violence even. And in 1991, the Rainbow Hotel was largely empty. So the first thing that Liz Evans did when she got this job was begin to fill it up. She took people in right off the streets. To give people an idea of the population that Liz moved into this hotel, I'll share an anecdote. Liz took an informal survey of the tenants that she moved into the Portland, about 70 people that she moved into the Portland that first year. And the average number of addresses that one of them had had during the previous 12 months was 11. So these were people that were kicked out, evicted from their homes again and again and again, 11 times in 1 year. Liz said this just was not right. And she stopped kicking people out. She stopped that cycle. Whereas other shelters, other hotels in the neighborhood would evict someone for open drug use, for a mental health outburst, for an overdose. Liz Evans said, "This is your home now. You live here, and we're not going to evict you for anything." if something terrible happens and you start a fire or you assault someone, we're going to have to call the police. But when you exit that system, you're going to have your home back here. This is your home. It was a really revolutionary idea in Vancouver in 1991. Before too long, this young man named Mark Townsend met Liz Evans at the Portland Hotel. Mark and Liz knew each other from back in London, where they were both originally from. Mark came to visit Liz in Canada. He was staying at her place, went by the Portland Hotel to visit Liz on her lunch break. A pipe broke. Mark fixed the pipe, and now Mark worked at the Portland Hotel. And it was just the two of them with these 7 rooms of chaos often, and giving people a home where they didn't have the added stress of a fear of eviction. Before too long, they renamed the Rainbow Hotel the Portland Hotel, and that's what you can see on your right there, renamed once again. Today it bears the name the Pennsylvania, but that's the Portland Hotel. Some really interesting things started to happen when Liz and Mark took people into this hotel and removed the fear of eviction. They found when you tell people if you have a mental health outburst, you won't be evicted. If you're caught using drugs, you won't be evicted. What they found was when that stress is removed, people had fewer mental health outbursts. People used fewer drugs. There were fewer overdoses. It was not this grand strategy that today North America calls the housing first model. It was really just Liz Evans being kind to her tenants and trying to give them a home that they hadn't had before. But it had that really interesting unintended consequence. When you remove the threat of eviction for mental health and drug use issues, you see fewer mental health and drug use issues. Really unintended, interesting consequence, a very interesting unintended consequence that today we call housing first. So that was happening in one area of the downtown east side along East Hastings Street. The Portland Hotel was getting up and running, and Liz Evans and Mark Townsend are doing really interesting things with housing first. In another section of the downtown east side, you had this a young woman named Anne Livingston enter the neighborhood. Anne Livingston had 3 children in tow. She just left a problematic marriage, moved to the downtown east side because that's where housing was affordable for her little family. Anne Livingston had a really interesting upbringing. She was raised very straight by a Christian mother and father. No cursing, no swearing in the household, nothing like that. No drinking, nothing like that. But Anne has these interesting memories of her mother as young as she can remember, 5, 6 years old, 7 years old. Anne would remember these girls a little older than herself calling and asking for her mother. Anne always wondered why were these girls calling for her mother all the time. Years and years later, Anne found out that her strict Catholic mother was running an underground abortion clinic back when abortion was still illegal in Canada. And so, while Anne was raised straight, she learned from a very young age, if the rules are wrong, you're allowed to break them. If the situation is wrong, you're allowed to change it. And when Anne arrived in the downtown east side, she saw things wrong in every direction she looked. This was the early 1990s, and there was an explosion of HIV/AIDS. There was an explosion of hepatitis C. There was gonorrhea burning through the neighborhood. And there was an overdose crisis, similar to the one that we see across America today. Before too long, Anne hooked up with this man, Bud Osborne. Devastatingly handsome, as you can see. But with a tragic past. Bud is originally from Toledo, Ohio. He had a very traumatic childhood. walked in to see his father kill himself when he was just 5 or 6 years old. Spent the next decade or so wandering around Ohio and surrounding states with his mother. His mother would drink a lot. She would bring men back to the trailer that she shared with Bud, and Bud would watch these men abuse his mother. He would feel these men abuse him. He witnessed his mother raped. And before too long, Bud Osborne was self-medicating with heroin, alcohol, and then heroin. And eventually, another decade or so later, something to do with the Vietnam War is the legend, Bud ended up in Canada with Anne Livingston. And the two of them, before too long, really became a force of nature. This is what the situation looked like for drug overdose deaths in Vancouver at the time. You can see there's a problem developing where overdoses are going, heroin overdoses primarily, are going higher and higher and higher. And this is the problem that Anne Livingston and Bud Osborne decided they needed to address. This was old school activism, grassroots organizing. Anne took out some felt pens and some paper and put up some signs all over telephone poles around the downtown east side. Bud went handing them out in bars and cafes. And they said, overdoses, HIV, are these the problems you want to talk about? What are the problems you want to talk about? Meet us in the park. They chose a park, Oppenheimer Park in the downtown east side, because no one would let them in the building, in any building. Drug users were not allowed indoors during this time. I mean, that's not an exaggeration. Community centers would kick them out. They didn't have a place to go indoors, so they met in the park. Between 60 and 70 people showed up at that first meeting in 1997 to talk about HIV, a lack of access to clean needles, new syringes, and the overdose crisis. And they got to work trying to solve it themselves. What can we do? This is that group that met in the park. This is their first indoor meeting when they eventually did find a community center to allow them in. And on the back wall there, you'll see a list of names. This is the list of names of the friends of people in that room who had already died of overdose by 1997. A long list of names. Before too long, this group has a name. By the end of 1997, this is the Vancouver Area Network of Drug Users, VANDU, which is still alive and kicking today. So in one section of the downtown east side, you have Liz Evans and Mark Townsend and the Portland Hotel Society, what they're now calling the organization that is providing housing first, providing homes to people in the downtown east side. And in another section, you have the Vancouver Area Network of Drug Users with Anne Livingston and Bud Osborne calling itself VANDU. And there's actually a lot of crossover here between VANDU and the Portland Hotel Society, primarily because many of VANDU's members were living inside the Portland hotels. And so these two groups begin to work together to call attention to the overdose crisis, using grassroots activism to get the word out beyond the neighborhood. There is something really wrong here, and nobody outside the downtown east side seems even aware of it. Another couple of years later, a fifth young activist named Dean Wilson joins VANDU. He was living in one of the Portland hotels. He was running drugs out of one of the Portland hotels, to be honest about it. But he found activism, and he said, you know, I'm a lion. I can be a lion, and do I want to use that to be a drug dealer, or do I want to change this neighborhood? So he got pulled into activism with VANDU and the Portland Hotel Society. And this is the sort of thing that began to happen.
If we just go in there, we'll get taken away.
It doesn't matter. We're citizens and we're allowed to go to council.
We're walking in at 2 o'clock and we just want to bring attention. Then we're going to be leaving. We'll clean up our mess and we'll be out of there.
Okay, and your name's Dean, right?
Yeah, Dean Wilson. And you can phone, like I've got that on right now. There's a problem, just phone me, officer, and I'll take care of it. Council's in session. Let's go introduce ourselves. Thank you. Good. Okay, Rich, that's all right. Right on. All right. We have a gift for the mayor.
Yeah. Margin, guys. Margin. Come on, guys.
90-day moratorium.
That's right.
You have a board of the mayor.
Sorry?
Yeah, we have
The mayor.
We're going to have a presentation from Councilor McCarthy from Van Duzen and asked to speak to council. I wanted to ask council I'd like to ask council what their wishes are on this item, whether we would delay our process and allow them to speak to city council. Okay?
One person today that's
One person can speak to us for 5 minutes. You speak, you move out so we can see. We can't see what's going on. You move back and the person will speak from that podium, okay?
It's not time for inaction, it's time for action. You've got to do something. I don't care what it is, even if I don't agree with it, you've got to do something. And I think it's time to end the moratorium now. And to have 90 days of inaction almost seems like you're sentencing us to death. Because every day somebody is dying. I think it's incumbent upon you, as representatives of our city, you know, we did vote you in, that you have to come down to our neck of the woods and give us a solution. One a day is dying. And if one of you were dying every day, every morning you woke up and there was one less person working in City Hall, I'll tell you that problem would be solved in 2 minutes. End the moratorium is all we ask. And then do something.
The moratorium that Dean Wilson spoke of was where the mayor, Philip Owen, right in front of us there, had essentially said no more needle exchange, no more services for drug users for 90 days. We're imposing a moratorium. And in response, Vandu marching to City Hall with the Portland Hotel Society and Dean Wilson saying, "You're killing us, one person every day." This was a tough spot for the mayor because these activists, this grassroots group of homeless people who were, regarded as nothing more than junkies in the mid-1990s, had gotten on the city's agenda, had gotten their message beyond the downtown east side, and had gotten the word out that between HIV, hepatitis C, and overdose, they were dying at a number that was unacceptable. And by now, the city's beginning to talk about things like injection sites. What is an injection site? A supervised injection site. What does the supervised element mean? Oh, they have these things over in Europe. We want to learn more about that. There's an education campaign underway. This is a very famous photograph of Dean Wilson that was taken in Oppenheimer Park at a protest in the year 2000. 1,000 crosses for 1,000 residents of the downtown east side who had passed away to HIV and overdose by that time. And now the Portland is really pressuring the city. That's Liz Evans, the nurse who formed the Portland Hotel Society in 1991. She's there inside this room with 2 members of Vandu. Inside this room that looks an awful lot like an injection site. Of course, you can't just go and build an injection site. That's illegal. And so they built a hair salon. Nothing illegal about building a hair salon. And what people do in the hair salon, well, that's another matter. No one ever actually injected drugs in the hair salon on East Hastings Street. They took the keys to the place to the mayor, and one of the Portland's employees, Dan Small, he whispered in the mayor's ear, "We built the injection site. I'm going to put the keys in your pocket. If you don't open a sanctioned injection site, we're going to open an unsanctioned, illegal injection site, and you're going to be on the news across North America." The mayor's eyes sort of lit up. So there was a lot of political pressure to open an injection site in Vancouver at this point. And a lot of activism going on, crosses in the parks, marches in the streets. And before too long, in the same room where this photograph was taken of the hair salon, this photograph was taken of Insight, opened in 2003, North America's first sanctioned supervised injection facility. You walk in at one entrance, pick up supplies from the desk there, go to your booth, inject your drugs, proceed to what's called the chill room, where you can hang out for a little bit, and then you can carry on with your day. And this was accomplished by activism. Today Vancouver sort of pats itself on the back for harm reduction, for injection sites, increasingly for prescription heroin, all these policies that are so progressive. But in the late 1990s, early 2000s, Vancouver did not want an injection site. The politicians did not want an injection site. This was very much the result of activism. And even after Insight opened, the battle did not end there. An education campaign had begun in the early 1990s. Insight finally opened its doors in 2003. And before too long, by 2006, Insight was in court. First, the Courts of British Columbia, the province. Second, the Supreme Court of Canada, all the way until this morning in 2011. 6 a.m., 2011.
Ain't gonna let no government turn me round, turn me round, turn me round.
The tension was incredibly thick. Most of us felt sick to our stomachs because everything rode on this decision. By 6 o'clock, the sidewalk was packed.
Stay tuned there on Hastings. It's going to be a historic moment any minute now. It's been a long struggle up to this point.
My hair was standing on end at that point. Dean was obviously very nervous about it. He was like walking around and fidgeting.
I found out because somebody came in from the back. I guess the CBC News had found out first, and the media informed one of our guys in the back room, who came out and grabbed me and told me that we had won. And I just crumpled. My knees buckled and I fell into Shelley's arms and just felt so emotional. I didn't think I could actually stand up.
Dean immediately just jumped up and went into the middle of the room of the Supreme Court building with his arms in the air. The relief and just joy of hearing the result just created a wave of jubilation over my whole body.
It was just an incredible moment. It was momentous, really amazing.
We won!
Statistically, 8 or 9 people a year would have died through the overdoses that we prevented. So being open 8 years, that's 72 lives. That's a win. I don't care what they said today. I'm really glad that they validated it. But to me, we won a long time ago. We won the day we opened that door.
I am so incredibly ecstatic today. I don't even know how to express it. Thank you.
Insight had to fight to survive, but some interesting things began to happen after Insight opened. The same business owners, these same community advocates who had protested against Insight opening, who had literally marched in the street to prevent Insight from opening, before too long came on Insight's side. They noticed that the needles that were previously left outside of their businesses were now left inside Insight or collected by Insight staff. They noticed that some of the homeless people who had previously used drugs in their doorways now used drugs inside of Insight. It was a very interesting thing to watch the loudest opponents of Insight, become some of its loudest advocates as they realized that Insight really was improving the neighborhood where they did business. And as controversial as it was when it opened in 2003, today Insight is an unlikely source of pride for Vancouver. You can buy Insight injection site t-shirts online, and you see these t-shirts worn around the city. The injection site has become an unlikely source of pride for Vancouver. But it was not easy. From an education campaign beginning in the early 1990s to grassroots advocacy, activism, marching in the streets through the early 2000s, through the court battle from 2003 all the way up until 2011. Insight was a 20-year struggle. It was not easy. And Insight worked. Combined with other measures, other harm reduction measures, needle exchange, outreach, advocacy, housing first, the number of overdose deaths that peaked in the late 1990s, 1998, began to decline and then declined further when Insight opened in 2003. And then fentanyl arrived. And all that progress that Vancouver made with injection, access to clean syringes, all of that progress faded away very quickly. These next round of photographs are taken from my reporting in Vancouver over the last 5 years. This is an overdose happening during an interview that I was conducting about overdoses when we were interrupted and had to respond to an overdose. Through this reporting, I met people like Janet Charlie, who's lost both of her sons to overdose. And here's the same graph that we've already seen twice. For a third time, the same graph, another 10 years added on to the end, and that crisis that was so intense in the 1990s that we had to revolutionize how we respond to addiction, that we had to open this brand new thing called an injection site. That crisis of the 90s is barely even a blip. It barely even appears on this graph because the crisis of today is so much worse. It became a very scary situation in the downtown east side. We're in the year 2016 now. The winter of 2016 was a very, very scary time for the downtown east side, when heroin was essentially replaced by the synthetic opioid fentanyl and sent overdose deaths skyrocketing. The ambulance service begins dispatching ATVs to run through the back alleys looking for overdoses. People living inside the Portland Society's hotels begin to ride bicycles through the alleys with Narcan, naloxone, teaching people how to use it, getting the word out. Come running here if somebody overdoses. Inside the Portland hotels, tenants begin to hold Narcan overdose response training sessions, trying to teach everybody how to respond to an overdose. People inside the Portland hotels begin adding Narcan posters to their doors, saying if there's an overdose, come knock here anytime, day or night. I can help. Taking matters into their own hands. And actions like this by an activist named Sarah Blythe, who was working with Anne Livingston in 2016, who you'll remember from our story about the Vancouver area network of drug users all the way back in 1997.
I think when Janet's son died, it was a turning point. You know, a lot of us went to the memorial and we were really touched by, you know, one of our workers at the market losing her son, and it was a very heartbreaking situation, and it became more and more close to home and more frequent, and the stories were one devastating story after another. We knew that, you know, no one really could stop us because we were doing the right thing.
Hey, he's dark guy.
Hi, can I get an ambulance to 62 East Hastings around back? We have an overdose at 62 East Hastings around back in the alley. The overdose hit. Yeah. One thing that we've realized is that the service that we're providing is extremely needed and extremely grassroots, and people can come in here right off the street and they feel comfortable working here, and we employ peer workers. And so I think that it's something the government should look at doing in a more serious way. It's beyond any kind of comprehension that people would be dying in the streets like this, and it feels like super urgent, but the government hasn't seen it as super urgent. You know, we haven't seen any government officials walking down here and seeing it for themselves. And any other crisis, you know, you see the elected politicians walking around and, you know, having something to say about the crisis. I would like to see the politicians come down here and witness this for themselves, because you just couldn't believe it. I think you cannot understand unless you see it for yourself what's going on.
So in 2016, Sarah Blythe on the left, former employee of the Portland Hotel Society, and Anne Livingston, the founder of the Vancouver Area Network of Drug Users, co-founder, get together and decide once more they've had enough of these overdoses. They put together a tent in a back alley. They throw down a bag of clean needles. They throw down a bag of Narcan, naloxone, and they say, do your drugs here. If you overdose, we're going to be there to help you out. To be clear, this was illegal, but as Anne Livingston learned from her mother when she was just 7 years old, if the rules are wrong, you can break the rules. So it took 20 years to establish Vancouver's first supervised injection site, Insight, standalone building, all the nice shiny equipment one could ask for. And here's Vancouver's second injection site, a tent in a back alley. This second generation of injection site was staffed entirely by volunteers at first, people like Lee Tran, who stayed out there every night through that cold winter. People like Sue, who had lost a friend to an overdose. I mean, everybody who worked at these sites had lost someone to overdose. And this is what they looked like. These were Vancouver's second generation of injection sites. Tent in a back alley, bag of needles, bag of Narcan, and let's go. It wasn't complicated, and it happened very quickly. And it was illegal. Here's one of these tents from the inside. Very bare bones, but very functional. This was 2016. 4 years later, there's a number of these sites running, and no one has ever died in any of them. No one has ever died in Insight, and no one has ever died in any of these tents. Some really interesting harm reduction things began to happen around these tents through 2016 and early 2017. On the right, you see our injection site. And on the left, what you see is a group of doctors who pitched a table of their own across the alley from the injection site. They borrowed Wi-Fi from the bank next door, and they said, oh, you're over there injecting drugs at the injection site. That's fine, that's cool. But if you want to walk over to this side of the alley, we can write you a prescription for methadone or buprenorphine, Suboxone. And some people did cross the alley and get their methadone there. And that's something really neat that began to happen around these sites. Here's the same data that we've looked at before but broken down monthly instead of annually. And you can see that winter of 2016, the very sharp spike just before 2017. There was already fentanyl, there was already a problem happening, but something scary happened during that winter of 2016. We didn't know what it was at first. Months later, we found out this was not fentanyl, actually. This was carfentanil, an even more dangerous synthetic. So in Vancouver today, heroin is essentially replaced by fentanyl, and now we see an overdose spike when carfentanil arrives in the city. I want to jump back. I want to emphasize how scary this was. When fentanyl arrived, we saw overdoses tick up from 20 per month, quote unquote normal, 20 per month to 40 per month over a year, and then to 60 per month over the next year. So, a triple the number of overdose deaths, increasing over 2 years. And then in just 90 days, we saw overdoses jump from 60 a month to 160 a month. From 60 a month to 160 a month. And that change occurred in just 90 days. And that's largely where the situation remains.
Sarah, Chris, and myself start on this thing, and I get into these pouting messes where I can't sleep, and I hear the sirens all night, and I'm feeling so terrible because I know the overdoses are really high, and months go by and we can't seem to take any action. And Chris and Sarah really sort of took the bull by the horn, so we were like, should we buy a Winnebago? Are we gonna get a gazebo? You know what I mean? That's the kind of thing you build. Or are we gonna get a tent or whatever? So we were just toying with all these ideas. So they said, it's happening tomorrow, Anne, and I sort of didn't believe them. But when I came out there, they had the tents up. And, on a very slow average day, we'd have 80 injections. But what happened was about 2 weeks ago, it was an overdose a day or one every second day back here. And that's a 12-hour shift, 7 days a week. And suddenly it was 3 every day. And you really saw impact. Insight then said they had 28 on the previous day, and that's a lot. You just think, oh, it's so high, it's not going to get worse. Well, it did. It tripled bad. You know what I mean? It really, really is a notable difference. The government really needs to step up. The idea that it's sort of, Canadian public health, oh, well, we'll get around to it. Maybe next year we'll get injection sites. You know what I mean? And meanwhile, you can stack the bodies up like cordwood. It's like a lot of dead people. It really is awful. We've all seen MASH, right? You just put up the tents and go for it. Like, really, let's go. Why isn't this being handled? Because I'm pretty sure it's illegal to let people die, and it's legal to save their lives.
That was Anne Livingston, of course, responding to the overdose crisis of the 2000s, just as she responded to the overdose crisis of the 90s. It was, coincidentally, it was during that winter of 2016 when I did most of my research for my book, Fighting for Space. So I spent a lot of late nights at Anne's apartment interviewing her about that crisis of the 90s. And Anne was just terrible to work with those days. I think she was very depressed. I think that it was very hard for Anne to live through a crisis of the 90s, see Insight open, believe that she had accomplished something, and then to have to go back and do it all again, when she's now in her late 60s. I think that was very hard for Anne. But some progress was made. The second generation of injection sites opened in 2016. The government did not shut them down. And again, it was activism. It was marching in the streets. Some people might recognize that coffin there on the left. That's the same coffin that we saw in our very first video that they marched into City Hall 10 years apart, that video and this photograph. The same problems. And again, people taking matters into their own hands. This is a fascinating picture. That's Sarah Blythe and her illegal injection site. And on the left, that's Health Minister Terry Lake. That's the region's Minister of Health watching people do illegal drugs inside an illegal injection site. And he's saying, okay, we're going to do more of this. Eventually, they did get the government's attention. And before too long, those tents are beginning to look a little more permanent. In some areas, they're brought indoors. This is Sue, who we saw earlier with her hand over her face at an outside injection site, now responding to an overdose indoors. I love this photograph because it shows how simple, how basic an injection site can be. This is literally a hallway on a ground floor of one of the Portland's hotels. And they threw down some tables through the hallway. Again, bag of Narcan, bag of needles, and let's respond to overdoses. And now these sites are really beginning to look more permanent. This is Vancouver's and Canada's and North America's only sanctioned smoking injection site where you can actually bring drugs to smoke, because we are seeing fentanyl, carfentanil in the crack cocaine and methamphetamine. And so this temporary emergency that the government thought it was responding to with injection sites is beginning to look more permanent. The next step that Vancouver is taking with harm reduction is prescription heroin, pharmaceutical heroin, diacetylmorphine. Instead of a dealer on the street, this is what's happening. There's no audio in this video, but I'll let you watch it to get a sense for how prescription heroin actually works. So rather than a dealer in an alley, it's a nurse in a clinic. And all of this began in Oppenheimer Park, where tenants from the Portland Hotel Society met with Bud Osborne and Livingston and formed the Vancouver Area Network of Drug Users. All of this began with activism. Today in Vancouver, the crisis continues. This is a photograph I took standing on a street corner. There are 5 ambulances in this photograph. There were actually 7 on that one block. 2 of them are out of frame. And I checked with the health authority the next day. Those 7 ambulances are responding to 5 different overdoses, all at one time. It's a war zone. And as the fentanyl crisis has crept across Canada, so has the activism that's responded to it. You can find this document online if you know where to look. Pop-up overdose prevention sites, a quick start guide. Teach you how to pitch a tent like those activists did in Vancouver in 2016. And that's what people did. This is Toronto in 2017. Zoe Dodd on the right there, who's led these efforts ever since then. Pitching a tent. That's Mary Lou. This is in Ottawa. Again, using that guide to open our own injection sites. And before too long, these sites in different cities, Toronto, Ottawa, this is Montreal, they began to look a little more official. And now we do have official sanctioned supervised injection facilities right across Canada. More than 60 of them last time I counted, possibly even many more than that. And similar things are beginning to happen, just starting to happen in the United States of America.
20 years my son's been a heroin addict. Donna tells us there's a good chance Taylor is here at the Corner Project in Washington Heights. It's a needle exchange, but also has this. One of the most controversial bathrooms in the country. A place where people, like Taylor, come to use drugs, but are also monitored and can be saved with a medication called naloxone, or Narcan, which can reverse an overdose.
When Taylor first told you about the bathroom, what were your first thoughts when you heard about that?
He's going to do it whether he wants to or not, whether he's going to do it under the bridge where they go, or if he's going to go in my bathroom and do it. At least there, I know that people are watching over him, and if he does overdose, he's not going to die, because they're going to be able to save him.
I think there is an acknowledgement generally that drug users are using bathrooms all over the place, and people are dying in those bathrooms. And so there is an acknowledgement that as a syringe exchange provider, we have a moral obligation to make sure that people don't die in our building.
Liz Evans directs the Corner Project. She moved here from Vancouver, Canada, where she helped found Insight, the home of the only legal safe injection sites in North America. Over 14 years, there have been over 3 million visits there, and not one single death. The rates of overdose in the surrounding downtown area dropped by 35%, and Insight users were 30% more likely to get addiction treatment. But here in the United States, this is a very gray area.
How does a place like this exist in the sense of the interactions with the legal world, the law enforcement world?
There are policies that exist that the state has provided to encourage access to Narcan, clean surfaces, and other suggestions for how bathrooms operate in syringe exchange programs.
So once I can normally
Hector Mata manages the Corner Project's bathroom program.
This is how actually our clients will do it when they come in. They'll sit down, they'll put all their supplies here to make sure that they're preparing like heroin or cocaine or whatever substance they're going to inject. There's a cooker with cotton in there for people to use it to like filter the heroin or whatever they are injecting.
You got an intercom in here so you can talk to somebody, check on them. You got a timer so you can sort of keep an eye on the time in terms of how long.
Yes.
What you're seeing is a particularly provocative way of trying to reduce death from heroin overdose. Some see it as condoning drug use, but others see it as a logical solution to a big problem.
So these things are beginning to happen in the United States. There's no happy ending to this story. The overdose crisis continues in Vancouver. It's gotten worse since COVID. The overdose crisis continues in North America, right across the continent. It's gotten worse since the coronavirus arrived. And the hope is that these stories of activism in Vancouver can help people in different jurisdictions. Vancouver has been through this before. Hopefully there's something that other areas can learn from us. Thank you. Okay, I'll take us off screen sharing, I believe. And Rachel, is Casey with us?
No, she hasn't joined.
Then why don't we open up the floor to Q&A? Why don't we try, well, first of all, I'll look through the comments here, and then in a minute, we can allow people to take themselves off mute. If that can happen in an orderly enough fashion, I'm happy to facilitate a conversation that way. And I see that there were questions in the Q&A too. Hello, Travis. Can you speak to the current grassroots activist movements pushing for decriminalization in so-called Canada? A nod to the Indigenous people who lived there before. If possible, can you also speak to the limits of safe supply? Yes, there is currently a strong grassroots movement pushing for decriminalization in Canada, and even more than that, pushing for legalization and regulation. Decriminalization describes a set of policies that would remove criminal penalties for personal possession. So if you were caught with heroin on the street, you would no longer, if you were caught with drugs on the street, you would no longer face criminal penalties. You would no longer be taken to prison. Instead, you might be given a fine. Instead, you might be given no penalty whatsoever. Legalization and regulation concerns the next step, not only addressing supply, but also addressing demand, but also addressing supply. So while there is a strong decriminalization movement in Canada, most of the people who use drugs that I speak with are actually pushing for legalization and regulation, which of course gets us to your next question. Can you also speak to the limits of safe supply? So Canada's had a experimental prescription heroin program running at Crosstown Clinic in Vancouver's downtown east side for many years now, but it's only been that one building. In more recent years, we've seen an expansion of access to a drug called hydromorphone, better known by the brand name Dilaudid. This drug is an opioid, very similar to heroin, but it's much easier to supply through the government. You don't need to go through all the red tape that you need to access diacetylmorphine. And so the limits of safe supply are very high around prescription heroin. It's just a lot of paperwork, a lot of bureaucracy. We won't really see a widespread expansion of prescription heroin. It's still simply too difficult to occur in Canada, but we are seeing an increasingly widespread access to hydromorphone, Dilaudid. This began in Vancouver and has since then expanded to other cities. It's happening very slowly. Doctors are not as involved as I think they should be, but it is happening. Our second question, how effective do you think their style of grassroots activism would be now, 30 years later? Well, we saw that towards the end of the presentation. I think it's actually been very effective. You know, the Minister of Health, who we saw in that photograph at the illegal injection site, he actually called me up one day. You know, we began to talk quite a bit actually in sort of an antagonistic relationship, me as the journalist, him as the politician. But he called me up and he said, you know, I couldn't sleep last night. I was in a hotel traveling for work and I couldn't sleep and it was cold. And I was thinking about Anne Livingston's tent. I was thinking about Sarah Blythe's tent. I know it's illegal, but I think we can do more of that. And that's what the health minister did. They took those illegal tents and they found a loophole. They found a way to make them legal. They said, we can't open injection sites overnight. That's a whole lot of bureaucratic red tape. You have to go through the capital city. You have to go through the federal government. And so we can't do that overnight. We can't open injection sites overnight, but we can open overdose prevention sites. Well, what's an overdose prevention site? Well, it's quite similar to an injection site, but it's this whole new category of thing that I'm inventing. And that's how they got around the red tape around the injection sites and opened these overdose prevention sites quite quickly. To answer your question, by relying on that style of grassroots activism that they first used 30 years ago and again used today. I'm wondering what the impact of the current pandemic has been having on drug-using folks and how the sites may have been affected. Great grassroots work and response. Keep it up. The effect of the coronavirus on the overdose epidemic has been devastating. Vancouver was really beginning to get a handle on the overdose crisis. We'd gone from 160 deaths a month down to 100, back down to 60. That's still too many, but things were really beginning to improve. And then the coronavirus hit. Some of these sites shut down temporarily. People were encouraged to stay in their rooms where they use drugs alone. Social isolation, mental health problems were exacerbated. And not only in Vancouver, but right across North America, the coronavirus has sent the overdose crisis to the worst place it's ever been. In Vancouver, even 5 years into this crisis, even after so much progress was, even after deaths were reduced, the coronavirus has sent overdose deaths the highest the city has ever recorded. We're up at about 175 every month now. You'll remember 10 years ago, a quote unquote normal number of deaths in British Columbia was 20 per month. And now for 3 months in a row, we're at 170 to 175. 8 times what was once considered normal. And that is happening right across North America. That's not only Vancouver. The coronavirus has sent overdose deaths skyrocketing right across North America. I've received a note here that we're actually not going to be allowing people to control their own audio, but if you raise your hand, I see that I can unmute you and you can ask a question that way, or we can continue to use the Q&A box. Ethically, how right or wrong is it to allow free open drug use? From my experience, most young people in my country, South Africa, use drugs when they want to harm people, either by robbing, raping, stabbing, shooting, and killing. I think it's the reason there's such a negative stereotype against drug use. It's a very good question. Around harm reduction, I've always believed that you need to take local context into account, that the situation in Vancouver might be very different from Johannesburg or Cape Town, and the situation in Philadelphia might be more different still. We do need to take local context into account. I mentioned earlier that Vancouver's downtown east side has a lot of poverty, mental illness, addiction, open drug use. One thing that the downtown east side does not have is guns. So while in Johannesburg or in American cities, you see a lot of guns, in Vancouver, the downtown east side might look scary, but isn't really because there's so few guns there. Ethically, how right or wrong is it to allow people open drug use? You'll have to forgive me, I'm gonna dodge the question, and I'm simply gonna ask, what's better, open drug use or drug use in the shadows? And as we saw in that silent video of a man accessing prescription heroin, I'll argue drug use in any form is always better out in the open, where it's regulated, where there are nurses available if someone overdoses. People have always used drugs. For thousands of years, people have always used drugs. And the world, North America, and increasingly the world's opiate supply is now so hopelessly polluted with fentanyl that people are going to continue to die of their drug use. I think if you accept those two basic truths, one, that people will always use drugs, and two, that with fentanyl, people will continue to die, I think that our only option is to bring this out of the shadows, out of the shadows, and allow for free and open drug use. That puts people in a place where they're a little bit safer, where there's less stigma, where instead of a dealer looking over their shoulder, it's a nurse. I simply think that's a better option. Are there connections to methadone Suboxone clinics and other services from these safe sites? We're still struggling to legalize safe syringe exchange in Texas. How can we access the data that shows the benefits? That's an excellent question. When Insight opened in 2003 as North America's first supervised injection facility, it was not just an injection site. I mean, it was, but it wasn't. There are wraparound services. When you go inside Insight, all you have to do is give a name, and it can be any name. It doesn't have to be your real name. And you're allowed to inject drugs. Nothing is pushed on you. But everybody knows at Insight there are connections to methadone. There are connections to Suboxone. There's even connections to detox. Everybody in the harm reduction world knows the name Insight. Not many people know the name OnSite. Directly above Insight, in the very same building, directly above the injection room, is a detox facility. So if you're at Insight and you're there to inject drugs and you're having a bad day, if there's a bed available, they can take you right upstairs and you can detox. There's connections to housing. There's connections to mental health services. Injection sites in Canada are not only injection sites, they are holistic gateways to the healthcare system. These newer safe sites are a little different. An injection site in Canada has wraparound services. The new overdose prevention sites fall under a slightly different legal categorization. This gets a little complicated, But the short answer is no, these new sites do not have wraparound services. These new sites do not offer referrals to methadone Suboxone clinics. There are good and bad reasons for that. While it limits related services, it means that the second generation of injection site is much easier to open, much cheaper to open, and can open much faster. So an injection site has a lot of government bureaucracy that it must go through, and then you get wraparound services. The overdose prevention sites don't have to go through any bureaucracy. They can open very, very quickly, sometimes in just a few days, but they don't offer these wraparound services. Let me see if I can translate a question. How could this policy be applied in a Latin American context? That's a very good question and something that I don't know a lot about. There is a book that covers some of this that has a chapter about harm reduction in a Latin American context. Some of you may have read it before. It's by a friend of mine named Johan Hari, and it's called Chasing the Scream. And there is a Portuguese translation of that book, Chasing the Scream, possibly also in Spanish. And he writes a chapter in the Portuguese edition that discusses how harm reduction could be applied in a Latin American context. I also know that there are harm reduction programs running quietly in Mexico City. There was even an injection site for women that was running quietly for a while, although I believe it may have been shut down. In the favelas in Rio de Janeiro, they have services for crack users. But I'm going to have to defer this question to someone who knows a little bit more about Latin America. Could allowing drug use bring more violence and spread of disease? I want to emphasize that the exact opposite thing has happened in Vancouver. Vancouver was the center of Canada's HIV epidemic of the 1990s. And since then, Vancouver sees fewer HIV cases than almost any other city. Especially among intravenous drug users, there is almost no HIV transmission. Clean syringes are available around the city, and this has almost eliminated the spread of HIV among injection drug users. Hepatitis C is similarly in lower numbers, and we've seen no correlation, no connection between harm reduction services and violence in Vancouver. What is the demographic profile of a drug user in Vancouver? And are most individuals who overdose on drugs in Vancouver overdosing on heroin or fentanyl, or are there other individuals overdosing on crystal meth? Another good question. The vast majority of overdoses in Vancouver do affect one specific population, primarily men, primarily blue-collar men working in the construction sector, or homeless, that sort of thing. And most of them are overdosing on a combination of drugs. So the majority of our overdoses are actually not one drug. They're not just heroin, they're not just fentanyl, or they're not just crystal meth, they're not just cocaine. They're usually a combination of those drugs. Another one that we commonly see in the mix is benzodiazepines, Xanax primarily, which is a very difficult overdose to treat because you can respond to the opiate, bring the person back with naloxone or Narcan, but they might still be unconscious because of all the Xanax in their system. And so while you've saved their life, you might not know that you saved their life because they're still unconscious on the benzos. That said, Vancouver's crisis is a fentanyl crisis. More than 90% of our overdoses in Vancouver and British Columbia involve fentanyl or carfentanil, the even more dangerous substance. So while our overdoses involve multiple drugs, Vancouver's overdose crisis is a crisis of fentanyl. Next question. Vancouver has recently introduced an opiate vending machine. Can you speak to the pros, cons of receiving substances from one of these machines as opposed to a nurse or a doctor? This is a very interesting harm reduction experiment that began in Vancouver under the supervision of a doctor named Dr. Mark Tyndall. Dr. Mark Tyndall said, "It's good that we have the prescription heroin program, but only so many people can have access. And it's very expensive paying doctors and nurses to administer that program. What can we do?" And the answer was an opiate vending machine, which is not really a vending machine. It's not the sort of machine where you receive candy or a soft drink, a Coca-Cola. The opiate vending machine is actually more like an opiate ATM, like a cash machine. It's very high security. It uses unique identities. I believe it's a handprint to verify who the client is. There again are pros and cons here. It's true that you don't have a regular interaction with a doctor or a nurse at these opiate vending machines, but you have a much easier access. And drug users in Vancouver are increasingly asking not only for healthcare programs, they want access to the drugs that they want to put into their body under their own authority. They don't want to go through, they don't want to go through a doctor. They don't want to go through a nurse. And there is an argument to be made there. I am an individual. I make my own decisions. I want agency over my own body. I don't want to go to a dealer on the corner who will sell me something of unknown substance. I want agency over my body, and I want to put, for example, Dilaudid, the opioid hydromorphone, into my body. That's what these vending machines offer, not heroin. They offer Dilaudid hydromorphone, a similar drug. And so what the machines do is allow individuals control over their own bodies. And that's the benefit, whereas the shortcoming is you do lose that interaction with the healthcare system. That's the end of our written questions, and unless I'm mistaken, I'm not seeing any hands raised. If people do have a question, I'm happy to unmute you when you raise your hand, or you can continue to use the question and answer box. We can give people just 1 minute. I'll also take this time to mention, if everybody wants to get in touch, my email address is travis.lupick@gmail.com. You can find me on Twitter at twitter.com/tlupick. And I see we do have one hand raised. Just a reminder that this session is being recorded and will be available on YouTube. Anna Mall, I believe you can now speak.
Yes, and I had a follow-up to my question I asked earlier about the wraparound services. If there are not wraparound services available directly connected with these new safe injection sites, are there harm reduction groups that are in the area that kind of hang near there? Because I know here we have, in Texas, we're in stealth mode. We have been for over 30 years. And we operate in close relationship with our sheriff or county, our police officers know that we exist and know to kind of leave us alone because of the work we're doing finally, but it's still a challenge for what we do. But I would hope that they're still there.
And I had to mute you again because there was some static on the line, but I believe that I did get your question.
I would just hope that they're still I would hope that they're still known at these sites, that they're making themselves known and available.
They very much are. I gave the answer that I did because it's not happening in an official capacity. At Insight, at other sanctioned supervised injection facilities, at official supervised injection facilities, you have official healthcare workers making official connections to methadone, to Suboxone. At this second generation, what we call the overdose prevention sites, there are still connections happening every day. It's just in an unofficial capacity. So this can happen, for example, at the front desk or at the with whoever is supervising at that time. They might have a sheet of paper with a list of detox facilities and phone numbers, and they can call around for you. It's just all happening in an unofficial capacity, but it is very much happening. I would like to add, though, that increasingly the conversation around harm reduction in Vancouver is about demedicalizing harm reduction, about removing the medical attachments of harm reduction. And so, again, taking the example of an injection site, the conversation is increasingly revolved around the user who does not want treatment or who wants treatment in their own way. And so there is increasingly less and less connections to official connections to healthcare, because the clients, the users, are telling us they just want a place to use drugs right now. And if they want treatment, they do know where to find it. And they know that somebody behind the front desk has that list of phone numbers. But this conversation is increasingly around individual autonomy, and giving people the right as an individual to say, right now where I'm at in my life is I need to use drugs, and being allowed to do so without any sort of connection to the healthcare system. All of that said, again, those connections are still available at these less formal sites and are still being made every day. Would anyone else like to raise their hand? I'm from Kathmandu, Nepal, a lovely city that I visited before. COVID-19 is affecting all of the ongoing services because government has announced lockdown, and it's hard to provide services in the field where clients cannot come into service sites due to vehicle problems. Is there any solution to address this problem? This is a very tricky problem. Harm reduction has been significantly complicated by COVID-19. That's something that we're seeing in Vancouver. That's something that we're seeing right across North America. I'm hoping that sites that previously closed are beginning to reopen now. I know that there are innovative ways that different needle exchanges are providing services. For example, instead of doing hand-to-hand transactions, creating sort of bags of harm reduction supplies, a bag with clean needles, with cookers, with tie-offs, and distributing harm reduction supplies that way. In the United States, I know that the postal system, that mail, has become one way that people are getting around COVID-19 restrictions. So where people don't have vehicle access, people are being mailed clean needles and that sort of thing. Of course, that is much more expensive. Coronavirus, COVID-19, is a significant challenge for harm reduction service provision. I see that there's been a couple of requests for some of the data behind this presentation. I'm more than happy to provide that. People are sharing their email addresses. I just want to remind people this is a public conversation and that this is going to be recorded. I'll share my email address. I won't be able to take anything down right now, but if anybody's looking for more information or statistics supporting some of the points I've made in this presentation, you're more than welcome to get in touch. It's travis.lupick, L-U-P-I-C-K, travis.lupick@gmail.com. And you can also find some of this information as well as a map of the presentation on the website for my book, fightingforspace.com. That's travis.lupick@gmail.com. On Twitter, travis.lupick, on Twitter, @tlupick. And the website is Fighting for Space, where there's supporting information. We'll give people just one more minute to raise their hands. Well, I really want to thank everyone for attending. Rachel, I get the sense that we're winding down. Is there anything that you would like to say or you would like me to say to begin to close? Okay, well, I just want to thanks everyone for coming. I really appreciate it. My social media of choice is Twitter, so I'm always happy to continue the conversation there. At @tlupick is my handle. I really thank everyone for coming. I really hope we will continue the conversation. Thank you so much for sharing the Downtown East Side story. I hope you all learned something. I hope you all were inspired. It's a story that was given to me as a gift, I feel. I'm inspired by it every day, and I really hope you feel the same way. Thank you so much for coming. And thank you to HIV 2020.